You may have heard of athletes going to training camps at altitude for several weeks at a time. What is the reason for training at altitude, and how does it even work? And there are four different scenarios here that we can look at. The first one would be live low and train low, which is just your typical sea level training. So you're living, for example, in commerce, and you're training in commerce. And obviously, there's no altitude involved, so we wouldn't see any effects of altitude on any of the performance measurements. We can live high and train high. So this would be you're living at altitude, you're living in the mountains, and you're training at that same altitude. So, for example, athletes in Denver, Colorado, they're living at higher altitude and they're training at the higher altitude as well. But we also still see no improvements based on the effects of altitude. And that's probably because at altitude it's harder to breathe, right? Everything is a little bit more sluggish, I guess. And so we would actually reduce our training intensity because it feels so much more difficult to do anything at altitude. So if we reduce training intensity, our muscles won't get the same stimulus with training, and they wouldn't adapt to the training. Also, living high and training high can lead to lower blood volume, lower muscle mass, and dehydration. None of those are good for performance measurements. There could be a live low, train high. So you're living in commerce, where you're living at the foot of the mountain, and then you're going up to train at higher elevations. Again, there's no improvement here because there's really no changes in VO2 max or hemoglobin concentration. It's just too short of a time frame, the one training session that you would do at altitude, to see an effect on erythropoietin, an increase in hemoglobin, or an increase in red blood cells. But you would avoid the negative effects of prolonged altitude exposure, such as the reduced, the low blood volume, the lower muscle mass, or the dehydration, for example. The fourth option here, the live high and train low, this has been shown to be to get a significant improvement in performance. So living high, you're living in the mountains, and you're coming down to the foot of the mountain, for example, or a little bit lower in elevation for training. So what that would do, you would see, because you're living at higher altitude, you would see the impact of altitude on red blood cell mass and hemoglobin. You would see the increase in EPO, which then creates the erythropoietin, and the red blood, the erythropoietin makes hemoglobin, and then the hemoglobin makes more red blood cells, or is in the red blood cells. So you would see an increase in VO2 max. How much is required? Living at altitude, 22 hours or greater a day at 2,000 to 2,500 meter is required. So you have to really live at the higher altitude. Or simulated altitude. So the hypoxic tents that they're trying to sell now, or hypobaric chambers, which we're going to talk about in a second as well. Those you would have to go up to 25 to 3,000 meters simulated altitude for about 12 to 16 hours a day. So still the majority of the day would have to be spent at higher altitude. There's still quite a bit of research into intermittent hypobaric hypoxia. So for example, 3 hours a day, 5 days a week at really high altitudes at 4,000, 5,000 meters. So living at a higher altitude would give you the increase in hemoglobin, the increase in red blood cells that you would need for the better performance, getting oxygen to the muscle. then training at a lower altitude, coming down to lower altitude to train, you can maintain your high intensity training that you wouldn't be able to do if you were to train at altitude. Some athletes still have slight problems in hemoglobin desaturation when training at low altitudes, but you can keep at least the training stimulus the same as you would at lower altitude levels. And the research that has been shown that this works has been done in 2001 or even before then. And what they did was they took highly trained runners, so they were collegiate men and women or elite men and women, and you can see the different dots, their race times as a percent of the American record. So American record is here on the right, and they're just off the American record, the elite men and elite women, and the collegiate men and women are a little bit off the American record here. But with higher altitude, you see an improvement in race time. So 0 would be there's no improvement. Anything above 0 means there's improvement in race time, and anything below the 0 is there has been a drop in performance. And what they've done, they have put these runners up to live at 2,500 meters, and then brought them down to train at 1,250 meters. And then they did the pre and post testing at sea level to check for aerobic performance. And aerobic performance improved by 1.1%, while VO2 max improved by 3.2%. Now that might not seem very impressive, but if you're that close to the American record, a 1.1% increase in performance, any athlete, I guarantee you, would take that chance to improve by just 1%. So in general, most of these athletes improved in their race times. There were a few that didn't do so well, and this woman down here, there was probably something going on with her either before or during the pre or the post testing VO2 max test. But in general, most of these athletes improved in race time after altitude training. Now, there's always a question about the elevation training mask, that really ridiculously looking mask that people wear in the gym, and then they do their training with the elevation training masks. The claim of this mask is that it mimics the effects of high altitude training. So from everything I just told you is that the most important effect, or the most sought after effect, is the increase in hemoglobin concentration. If we have an increase in hemoglobin concentration, we can get more oxygen down to the muscle. But I also just told you that the hemoglobin doesn't increase, or increases only after about 2 weeks of chronic low PO2 at altitude. And the low partial pressure of oxygen is something that you cannot get with the altitude training mask, with the elevation training mask. You're still breathing sea level air if you're at sea level. It's only a resistance in the airflow that you would get, but the PO2 is still the same, and it's not a simulated altitude. Also, it has to be chronically worn and for greater than 2 weeks. So chronic, and I just told you about 22 hours a day has to be worn, but usually people just wear it during the training session. Let's say they wear it for an hour a day, and that's just not enough to get any of those effects that we would see at altitude when we live at altitude. It also claims that it is a resistance training device that helps condition the lungs by creating pulmonary resistance and strengthening the diaphragm. In fact, total lung capacity or lung capacity does not increase in the healthy adult. Right? We are stuck with the number of alveoli and the number of airways that we have. There's no increase in total lung capacity in the normal healthy adult. So, and also the diaphragm is one of the most conditioned muscles in the body. It's constantly working, right? It's never still. If it was still, then it would be dead. So it's already really strong, really conditioned, and it's very unlikely that the elevation training mask will strengthen the diaphragm even more. It's already so super conditioned that 1 hour of wearing this mask is not going to do anything. Also, by restricting the airflow during exercise, this makes it a lot harder to train, right? So you will actually decrease the exercise intensity, and the only thing you'll do by doing that is reduce the stimulus for any adaptations in the muscle to occur. So actually your workout will be negatively affected when you wear the elevation training mask. So save your $80 or however much, I think that's what the mask costs now. Save it and figure out a different way to get your exercise or performance improvements.